Hello, everybody. Thank you for joining us. Thank you very much for joining us. If you can hear me and you can see me, please put a comment box, and I'll be very glad to hear from you as well. Thank you once again for joining us. Was very sorry for starting circumstances beyond our control. We're happy to have you all. Welcome, Adeyemi Adiola. Welcome. You're the first person to show up today. I wish we had a prize for that. Welcome. All right. So, thank you, Gospel. Welcome, Gospel.
Thank you very much. It's nice to be here. Good evening, everybody. Thank you for joining us.
So, I'm just going to hand over to Gospel while we get set to start in the next 2 minutes.
Hello, everybody. Welcome to another episode of the nursing quiz, and specifically it's for nurses of all caliber. And basically, we just want to ask questions and hope that you answer it within a time frame. And there are cash prizes for any question that you answer. So we urge you that once you answer a question, don't leave. You have to hang on till the end of the program so that we'll let you know how you can redeem your prize, and we will let you. It's an opportunity also for you get um get the answer to more questions and get yourself more money. So it's a good avenue for us to refresh our knowledge about our nursing, like the nursing skill. For some persons that would have left school for quite a number of years, it will be an opportunity for you to refresh your knowledge and also learn something new. And then for the folks that are still in school, nursing school, it's an avenue to get to learn something new and also um, refresh your memory on what you've learned in school. So welcome again, welcome again. We hope that we have a swell time tonight, and we don't just have one person like the other time go home with all the money. This time around, we hope and we trust that would have different persons answer the question and go home with our money today. So if that's Damilare, are we okay to start? We can't hear you.
Yeah, I got that. Sorry, I was muted. Yeah, so thank you
Okay.
everybody for joining again. So that's it. Thank you, Gospel, for that introduction. So basically, we have up to 50 questions, and if you saw on the flyer, we said you can win up to 50,000 naira. So we've got 1,000 naira for if you joined us last week. I'm sorry, last month. What we did was you would notice that if you got a question correctly, you won yourself for this month. We have moved up a little bit to 1,000 naira just because we feel it's
Oh,
worth
wow.
it. You know. However, most of the questions are not just one answered question where you just say one answer and that's all. It's going to have a number of responses. You're expected to give a number of responses. For example, you are asked to talk about what would you do for a patient who is bedridden, just for example. And last month we talked about, oh, you need to reposition, oh, you need to ensure you care for the pressure areas, oh, you need to make sure that, all of those things. There are at least three, four, five things you must mention. So if you mention two out of the four you are expected to mention, then you are getting 2/5 times 1,000 naira. If you get one out of the five, you're getting so for you to get the full 1,000 naira, you must answer the questions all correctly. And then number two, you must answer it promptly. All right. Before we start again, let's recognize everybody joining us. We have a good turnout today. Namapi, Victor Adeyemi Adiola, thank you for joining us just last month. Thank you for joining us. We're happy to have you back again from Lautech. Uh, we've got Rebecca as well. Thank you for joining us. We've got Esther. Good evening to you too as well. Thank you for joining us. All right. So, gospel, I think it's about to start. So we don't keep this too long. Welcome, the nurse influencer. Thank you also for joining us. So this is how it goes. All right, put the question up, and when I put the question up, gospel is going to read it out to your hearing, and the timer will be up for 60 seconds. Now, once the time is elapsed, sorry, that's the end. Then we are seeing all your comments up here. Whoever drops in the first comment will see it, whether you're on Facebook or you're on YouTube or wherever you're joining us from, we'll be able to see it here. So we'll read out your comments, we'll even highlight it and you see it. Okay. So let's do a quick test run. I'm going to put a question up just now and we'll just for everybody to be aware of what we're doing here. Okay. So I'm going to go to a very simple, straightforward question. And we're going to just do it together. Okay, so a a medical term. Let's just put this up now. Now, so this is the question up now. So while gospel will be reading it out, I'll be putting up the timer. Go on, gospel.
A medical term for difficulty in breathing is your time starts now. So once I read out the question the first time, the timer starts. It's for 60 seconds, and then thereafter, once the timer has started, I'll read the question again. So if you didn't quite get the question the first time, you will be able to have a go at the question again the second time. And then after 60 seconds, which is 1 minute, the timer goes off. But we just need the first person to give us the answer. We're just trying to test run it just now. So we're already getting answers already. But that's more like what the quiz is about, or how the quiz will be done. So I can see a lot of answers already. And
Yeah, yeah, yeah. Good. So I think everybody has gotten us now. So we're going to start just now. Okay. And it's not going to be this simple anyway. So I'm sure when you see the real questions, you will to to really put your answers together. So I'm going to just take this away. Like you all said, the answer is this here. So the answer is showing right on the screen. So now let's go to the very first question. Okay, get your pen ready, get your keypad ready, whatever you're getting ready, get it ready. Okay. Now the first question for today.
all right, so we have the first question. The question is, when assessing a patient with severely elevated blood pressure, what key clinical manifestations would indicate the presence of hypertensive emergency? Mention five for full price. So your time starts now. So you have 60 seconds to answer the question. It says when assessing a patient with severely elevated blood pressure, what key clinical manifestations would indicate the presence of hypertensive emergency? So we have five answers and your time starts now. We're just looking for the fastest and the correct answer. We are looking for five answers from you. So just take your time, and as you're taking your time as well, try to give us the correct answer. Uh,
I'm seeing some responses already. Interesting. Try to put your answers together so we can so you don't
Together,
have
yeah.
someone else. Yeah, preferably list it. Think about it for 20 seconds. Oh, that's all. That's
Yeah,
all.
your time is up.
So let's go to the answer. The answer is this.
All right. So our answer is severe headache,
Yeah, go
blood
on, gospel.
pressure,
It's yours.
chest pain, shortness of breath, neurologic deficits, and signs of end organ damage such as kidney failure, acute kidney injury, heart failure, or hypertensive encephalopathy. All right, so um, I think we've got some answers
Okay,
here
so let's
already.
look through the comments. Let's see how many people had something close to it. Anyways, anybody who is coming in from 6 p.m. Unfortunately, yeah, I think we've passed. It's already gone. The timer
Yeah,
stopped at exactly
6:11, right?
6:11 p.m. Well, yeah. Let
Yeah.
me spotlight the responses we got here. Let me spotlight the responses we had. The first person said, the first answer was I did look more, but I said heart attack. Someone else came and said, Adeyemi Adiola said elevated blood pressure, severe headaches. So this person got severe headache correctly.
Mm-hmm.
Eclampsia, the nose influenza, that's out of it completely, so it's not correct at all. Esther DBC is edema. That's not really in
No.
line with the answer. Profuse sweating, restlessness is in line. That's two out of it. Then we also had acute renal failure. Well, that's it. Part of it, organ damage. Yeah. Systolic reading of 160. Severe occipital headache. Close to it. Close to it. Something very nice there. Severe occipital headache. Heart attack. Let's see. This next person said heart attack. This next person from YouTube also said IBP, anxiety, edema, sweating. I'm just spotlighting every answer we had. Aortic dissection. Oh my god, that's stuff.
That's grand. The person is moving stuff.
That's grand stuff. BP reading of 180, 120. Okay. BP reading of 180, 120, edema, chest pain. This was eye dizziness. Okay. Oh, this person is looking like what we expected. Okay. Severe headache, gospel C again. Severe headache, chest pain, shortness of breath, vision changes, neurological symptoms like confusion or seizures. This is very close to what we wanted.
Yeah, but the problem is I just came. I think he came at the nip of time, which is 6:11, and
Yeah,
for me, I feel
yeah, it's
I
still
feel
six
like
in one. So,
I feel like the person that should get the prize should be what's the name again? Sorry, um, Adeyemi Adeola. She should be getting the prize because she gave us quite some answers, uh, and it was early enough. So we can't really say for those that came in around 6:11. We can't really say it is not after we had given the answer. Do you get what I mean?
Well, the the good thing is we have somebody who's got one, two, three, four, five of them correctly stated, and she came in at the
Yeah.
time we expected. So
No.
definitely the prize is going to her.
Oh.
Interestingly, she won our prize last week. She's already, I think she already knows the technique. And like I said, everybody listening, this is how it is. Take your time to ensure that it won't help you because you might have dropped one just before the time elapsed and you drop the other one. So it doesn't make much sense. So preferably put all of your answers together and ensure to drop it within the 60 seconds time grid. That would help a lot. You can take 30 seconds to think or 20 seconds to think and then just drop it. So for this very first question, gospel, I think it's quite a bulky question. So I understand
Yep.
that
Might take
a lot
time
of
to
people
answer, right?
made attempts, good attempts, but
Mm-hmm.
the person who's got the most correct answer and who came right on time, Oluwabamere Ojediran. All right, so we're giving it to her. Thank you very much. Let's go to the next question.
Kudos to Oluwabamire.
So that's the answer
Thank
again.
you.
You all can see the answer. Kudos to you again. Kudos to you.
All right, let's move
All
on
right.
to the next.
So now let's go to the second one. If you're all happy with that, put it in the comment section if you're happy with that decision we have made.
If you are not happy, protest too.
Protest, and give us a strong reason why you you deserve to win it. But that's it basically. She gave us all we
Yeah.
needed, and just like you saw in the answer as well. So let's go to the next question. Let me see what this comment is saying
All
first of all.
right. Okay. So she's
I'm
happy.
happy. So at least we've got one person supporting us. The next question, number two, showing just now.
All right. A patient presents with a blood pressure reading of 200 over 110 millimeter mercury and reports severe headache and blood vision with no signs of acute organ damage. This is hypertensive, A, emergency, B, urgency. I think it's just one answer we're looking at, right? For this question.
Yes, just one.
Someone, do you have someone say?
Just one. Who is the first person?
We've
Is
got
somebody saying
to we've got Rebecca, I know. She
Rebecca is
says
undecided? Rebecca is
urgency and then say
undecided.
urgency. As in, I don't even understand.
Anyways, let's see what's good.
I can't understand. Oh my god. We have 17 seconds left and all. 8 seconds more.
Okay, she said she's decided it was a mistake. She said it was a mistake, so we'll go with your second option.
All right.
She got it right anyway. She got it. She was the very first person to drop the correct answer.
Yep,
So let me
yep.
first of all show the answer. Answer is
So
hypertensive
it's an
urgency.
hypertensive urgency. In this scenario, the severely elevated blood pressure without evidence of acute organ damage is categorized as hypertensive emergency. Thank you. So we've got a winner, right?
So we are going to give it. We are going to give it to Rebecca because she won she gave urgency first, even though
Yeah.
I am feeling like emergency in her real mind. I don't know what you think, but she's already got it. Let's give gospel.
She's got it right. She's got it. So let's give it to her.
Let's leave it at that. So I think a lot of people are not even sure. So I can see urgency, emergency. I believe you understand the difference just now. Urgency
Yeah.
is basic thing is when they rate it, and that's why the question again with no signs of acute organ damage. So that's the clue there. Once you can elicit urgency, once there is any sign of organ damage, it is emergency. Okay, and the protocol of intervention differs. So you can read that up. You can read that up in your browser so that you get a lot of stuff there. But just put it online and you find so many good stuff to help you. Okay, so the answer again is hypertensive urgency. So let's go to the next question. Gospel, should I go on?
Yes, 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 yes. A postoperative patient is at risk for deep vein thrombosis. The nurse implements dash to prevent this complication. This question looks like something that we asked last week. But anyway, your time starts now.
Yeah.
All right, so your time starts now. Have we started the timer? All right, that's our time up. So, can we get the answer, please? So, the answer is early ambulation, application of anti-embolism stockings, and administration of prophylactic coagulants, anticoagulants rather. So, I think we've got a winner. That's Rebecca as well. So, bed rest now. No, no, no.
So the first response was from this person. Then the next response is this.
Yeah.
Then we've got this as well. Then we got this. Then we got this. Then we got this. Uh, so we got this as well. This. So of the responses we had, or we have, the one from Rebecca, I know, use of I believe is anti-embolism stockings, prophylactic anticoagulants,
Mm-hmm.
and early ambulation. Yeah, so that's good. Anyone who joined us for the last week's edition would have seen this question. It's just intentional,
Yeah.
just to ease up all of this stuff. Okay, so that's good. Gospel, who is getting it?
Um, I think we should give it to Rebecca. I know she got the
Yeah, it
she,
goes
her
right
answer
there.
came right on time, and it's quite close to what we have. I know we have like five answers, right?
Mm-hmm. Yeah, yeah,
So
yeah. That makes sense. So
yeah.
we're good.
So please
Let's
don't forget
see.
to
What's the next
don't forget to stay with us till the end of the program
question?
this evening so that we can tell you how to redeem the prize that you just won for yourself. So please, can we move over to the next question, please?
Okay, thank you very much, Gospel. Sorry, my network seems
Yeah.
to be unstable. I don't know if that's the case, but we'll just pull this through. We'll
Mm,
pull this through for today.
yes, I think so.
Okay,
Yeah, your kids' network.
I'm going to put up the next question. Is that okay?
Yep. So the next question
Go
says,
on.
when initiating the patient on an ACE inhibitor for hypertension, what consideration should the nurse keep in mind regarding the timing of medication administration, and why is this important? So your time starts now. So when initiating a patient on ACE inhibitor for hypertension, what considerations should the nurse keep in mind regarding the timing of medication administration, and why is it important? Angiotensin converting enzyme inhibitor. So the time is up. All right, we got answer.
Okay, this is the answer.
Okay,
Okay,
wait, let's
and
see what
let's
I
start
get.
from uh, the first person. The very
Let's
first
see the
person
answer.
said Victoria John. Can you
So
see it?
Victoria John says, yeah, she says it shouldn't be administered at night so as not to obstruct, not so as not to disrupt patients' sleep.
Yeah, that's reasonable. That's reasonable, but I'm not sure that matches what we have as the answer yet. But let's go on.
Mhm. The nurse should consider the timing of
Exactly.
medication administration. This helps
Go on to the
consistent
next.
level
Oluwabamire.
of the medication throughout the day.
That's very correct. That looks like what we want. That looks like what we want. Victoria John. Okay, she's trying to buttress that. Oh, well, when it comes to frequent urination and antihypertensive, I think there are uretics have that. Okay, you can correct me if I'm wrong, but I think diuretics have a problem. I mean, diuretics is the one that causes this whole thing of
Yeah, the
frequent
frequency.
urination, not ACE inhibitors. Even if
Yeah.
ACE inhibitors would have such effects, it would be very might be very minimal. Okay, so um, the person who's got the answer, we got another answer here, but it still doesn't match what we have. Monitor our vital signs, WBC clowns. Well, that's about, we're talking about the timing. What are you going to educate the patient or talk to the patient about the timing? So the timing is the focus. And Luabamire, she was able to talk to us about that carefully. She said the nurse should consider the timing of medication administration. This helps to maintain consistent level of the medication throughout. Answer close to the answer, but we see this is actually what the answer is. Advise the patient to take consistently at the same time each day for steady blood levels and then to enhance adherence. So so that's it. Um, Gospel, what do you think? Who is going on with the who is winning this one?
No, it's still Ojediran. Are you with me, Damilari?
Yes, yes, I am with you. I can hear you very well.
Yeah, so I think it's Ojediran.
Okay, so we have that set. Okay, we have that already set. Ojediro, thank you for putting in the correct answer. Let's go to number five. Question number five.
All right. So when assessing a person with hypertension, what signs should be observed for early detection or complications? Your time starts now. It's a hypertension night. Are you already giving the answer?
Oh my God.
All right. We have 45 seconds. Can we have the question as the time is going? So,
Again, try to put your answers together. If you're okay, we are getting answers already. This is the question. Sorry for taking out the question. That's the
if someone
question
assessing a
showing.
person with hypertension, what signs should be observed for early detection or complication? Time up. All right. So
Okay. So
the
the answer
answer is
is
facial droop, arm weakness, sudden severe headaches, changes in mental status, that's in terms of alertness and orientation, dizziness and or visual disturbances. So, do we have any correct answer?
let's see what the comment says. Sorry. Okay, I'm going to go up. I think that started from here. The first person said the blood pressure. That's not it. That's not it. Chest pain. Chest pain. Yeah, that might also matter. Okay. She said blood vision, severe headaches, chest pain. She said blood vision, severe headaches, chest pain. So we have somebody who said three correct answers. Is that Then we've
So we
got
have
somebody who said
blood vision.
organ failure, blood. Oh, sorry, I should show you that. Organ failure, blood vision, headache, sweating. She got
No.
three. So this one, we are going to be generous with this particular one. We have to be generous. Oluwabamire said all of it. Frequent headaches, chest pain or tightness, shortness of breath, vision changes, dizziness, and difficulty speaking or understanding. So she's got almost all the five. She got all the five. She got someone else said blood pressure, eyesight, in apples, dizziness. Trying to see if we have any other whose answer. Idris Pokuola said facial droop, headache, orthostatic hypertension. Well, Quizmaster Gospel, what do you think? So let me go back into to highlight all the answers we got.
Only master.
Yeah, the Quizmaster. Oh yeah, now. What was the? I think the nurse influencer should get something for
But again, we said
being
your answers have to
prompt
come
with
all
three correct
together. So
answers because Gospel, are you with me?
yes, I am.
Okay. So what's your decision? Sorry. We have headache all of this here. One, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, almost 7 options. So let's see who's got at least 5 of them, and the person can take. We've not concluded on this yet. Okay, let me go again. Let me go take a quick look. So we're gonna do it this way, gospel, just like we did the last week,
Okay.
for some for to encourage everybody. Let's say the nurse influencer mentioned chest pain is also something to look out for. Okay, so it's correct to say so. Um, she's got three correct answers out of 5. So 3 out of 5 of 5. That's for the nurse influencer. Then we also have Esther DBC who said organ failure, blood vision, headache, sweating, edema. Organ failure is not a sign. You need to tell us what you're looking for. But she got the blood vision,
Yeah.
headache, sweating, edema. So somebody who is just give her that 4/5 of 1,000 for Esther DBC. Then Oluwabamire was able to say one, frequent headaches, chest pain or tightness; two, shortness of breath; three, vision changes; four, dizziness; five. So she's got five. That's 1,000 naira to her. Then we have
Next person should be Idris Popola.
Rebecca. I know also. Oh, have I spotted Rebecca? I know at all. She said blood
No, not at
pressure.
all. It's
Blood
just
pressure.
that
What?
if you look at the
No, that's not.
answers,
That's
if you look at the answers, they don't seem appropriate. So I think the next person should be
yeah. They don't
Idris
seem appropriate.
Popola.
They don't seem appropriate. Yeah. Idris Popola. Yeah. Facial droop, which is closer. Yeah, closer to the stuff. Headache. It's supposed to be orthostatic hypotension. If you want to
Yeah,
put anything like that, uh, I want to assume that that was because of some typo errors.
yeah, maybe.
So dizziness, tachypnea. So he's got facial droop, headache too. I'm just going to give him that hypotension because that's supposed to be an error in typing. Three, dizziness. Four. Well, tachypnea. Okay, these are just general signs you will see in anybody who is having any form of, even though it's not what we're actually looking at. If you look at the direction of that question, is we're actually tailoring towards somebody who is having an impending stroke,
Yeah,
right? So anybody who is watching this, you can picture that, oh, somebody who's having an impending stroke, facial droop, all those weakness of the arms and legs, all those confusion. That's actually the direction that. But a lot of people are tailoring it towards heart attack, chest
heart
pain, all
attack.
that, which
Yeah,
is also correct. Yeah. So that's why I'm not trying to just go away. I mean, look away from the other answers. So I think we've noted everything. Kenny, have we noted
yeah.
everybody? So let's give. We're also giving this young man, I believe, Idris Popola. How many is that
The latest arrival,
gospel?
guy. So I didn't quite keep the track with the persons you are giving. So
Okay, no worries. Kenny is doing that. But I
okay.
mean, how many of these questions, these answers are correct here? So we have facial
Yeah.
droop one, headache two, obstacle hypertension three, dizziness four. So let's just say five. Five. He's got all the five. Okay, he's got all the five.
Okay.
This last person came in late, unfortunately. Adeyemi Adela came in
Yeah.
late. Well, thank you all for joining. Because of some of these technical glitch, I'm just going to we are going to have a quick break. How many questions have we done now? I think we've done six.
I think five. Is it six?
If you know, please put it in the comment section.
I think five.
Anyway,
We've done
let me
five.
just check. We've done number five. So let's take a quick 1 minute or 2 minutes break, and we'll be back with, oh yes, Oluwabamire said five. So let's take a quick break, and we'll be back um, to continue from here. So watch and enjoy. Okay. Yeah, no worries, no worries. All right. So yeah, we are back. Thank you very much. Thank you very much.
Oh my God.
It's supposed to be a fun environment.
Oh my God.
Thank you. Never to be caught unguarded, huh? But we caught you unguarded.
Oh my God.
Let's go to the next question. One. Are we happy now? Good to flex. Gospel, are you?
Yes, we apologize for the glitch in the network. So, number six, it says, how can you effectively address the financial constraints that hypertensive patients may
No,
face in ensuring access to medical necessary medications and preventive care? So your time starts now. How can you effectively address the financial constraints that hypertensive patients may face in ensuring access to necessary medications and preventive care? I think this question is more like what you get in public health exam.
yes, so it doesn't have to be clinical all the time now.
Yeah. So by writing to the social worker department for help. Hmm, social work, good. That's good. Connect to social workers, encourage them joining NGO that help patients with cardiac problem, encouraging NHIS joining. That's good.
Oh my god,
That's time up.
that's good. And that's all. the last answer we got,
Say helping them to get work. That's funny.
that's okay. We help them to get work. We give them work. We are now Tinubu.
All right. So what's the answer?
That's
Explore lower cost medications, provide info on patient assistance programs, incorporate budget friendly lifestyle modification, and emphasize the long term cost effectiveness of prevention. All right.
so who is close to the answer? Actually, some of the responses are close to some of what we have to. For example,
Yeah.
somebody who said NGO encourage them to
Yeah.
join NGO that helps patients with care. That's more like patient. Let me see again. Let's
Assistance
start from the
programs.
first one. Yeah, let's start again. Let's start again. Okay, the first person is the first person to drop any stuff here was Mubarak
Barry.
Ayodeji,
Mhm.
writing to the social worker department for help. Yeah, social work department. Yeah, hopefully they have something for them. So that's one. He's got something that is somehow close to provide info on patient assistance program.
Yeah.
Okay, so I think we should, yeah, we keep that. Technically, we are changing our rules, gospel, because
Exactly. That's what I wanted to point out now that
initially
we're
we are
changing
only
our
giving
rules.
to
It's
one
turning
person
to
who gets it. Now,
who gets the answer in time, the first correct answer. So
yeah, the
I
first
don't know.
correct answer. But right now, we're going to need to just do a wee bit of change of rules, just to accommodate. Yeah, a lot of people putting effort, and that's really impressive. Okay, I see somebody say connect social workers, encourage them to join NGO that helps patients with care, encourage NHIS joining. No worries, no worries. I understand that was because of the you have to put something down very fast. I get. Yeah, peace, health education, advocate for your patient. Okay, now if we want to do what we did the last time here, it's going to be difficult because many people did not get. But
I think we should just let's just give it to
we're just going to
uh, let's just give it to I think the
who
first
got
three
it,
questions.
who got the closest. I'm still trying to see. No one really got it.
Just we could just give
Made
it to Mubarak
3 to 4.
cause
No, let's see,
um
let's see, gospel, let's see. Have you seen all the responses? Can you see intervention of social workers? Rebecca, I know, said also encourage for less expensive. Yeah, this is closer. Rebecca, I know, is making a lot of sense. So she's made NGO social support, NHIS, less expensive drug reassure. Yeah, she's made at least three correct points that corresponds with what we have. So Rebecca, I know, is closest. Advocate for the patient through the hospital social welfare, then educate them on the treatment. Well, still two lesser than what we have from I know. So we're going to be
Let's just give it to her,
make them know that the problem that may arise when they did not take the medication. We can't make the drugs free. Unfortunately, nurses cannot make the drug free. Educate on the insurance scheme. Yeah, so I know it's the closest. So Rebecca, I know has it. Rebecca know has it. Rebecca, I know. Okay, Kenny, are you taking note of that? Rebecca, I know has it. So she's got, I think, from all of what she mentioned, she had NHIS three. So let's give it to her. She's got 4 correct answers, and that's good enough. So 1,000 naira goes to Rebecca, I know. So you see, we're not very strict.
Yeah.
We just want you to think critically and give your best. We are looking for the best and the most correct answer. There is no one way to it. There are stuff that would require you to think. So if you come up with solutions or answers that are not exactly what we have written, they match. I mean, they are real answers, they are correct answers. We're still giving it to you, okay? So we are going to number. Well, this next question is going to be a little challenging because I think I've made a little error here. The answer is not here, but we're just going to pick the answers from whatever anybody says. Okay, so let's go.
What strategies can you employ to address patient concerns on and enhance medication adherence? I don't quite get the question myself.
Oh, sorry. To address patient concern. Yeah, yeah. So, strategies can you employ to enhance medication adherence? That's actually the question. So, like I said, that was an error there.
Let's just take the next question. So,
Okay, let's take the next question. Thank you. So, we're going to take this out. Okay, this is a question.
an elderly patient is admitted with confusion and disorientation. What nursing assessments and interventions should be prioritized to address the risk of delirium? Your time starts now. All right, so that's time.
That's all. The last person is Oluwabamiro Oluwa, who said conduct a thorough assessment. Anyway, so let me look for the answer first of all and put it out. What's the answer?
Perform
Perform.
a thorough cognitive assessment, implement environmental modifications, and provide
Oh my God.
orientation
Come up, come
skills
up, come up.
to prevent delirium.
Thank you. Thank you, Gospel. My network is really crappy tonight. But
Yeah,
we're
I
just
know.
gonna flow.
You and your K2 network. They come to the island, you refuse.
Okay,
You're
I
on
don't
the
hear you.
mainland. Your mate, the island.
We should come to the island.
Come to the
Better
island. You say
network on
no.
the island. The the Ajegunles. Let me see the answers our friends have dropped. Where did we start from? Somebody said we should start by collecting vital signs. Somebody says assess the orientation to time, place, and person. Glaucoma skill, cognitive assessment, mental check for mental confusion, environmental orientation. Ah, this is close. This is it. This is it. This is it. Rebecca,
Rebecca,
Mr. Davis is saying this glaucoma
Rebecca, has our
glaucoma assessment. No,
marking scheme.
she has it too. She has it. Ah,
She has our marking
she
scheme.
has
Oh.
it. I need to ask her how she's getting all the. She's using the keywords that I put down. Assess the level of anxiety and okay. Review their medications. Well, so I think Rebecca I know has this one. She's got the most correct answer, and
Yeah.
she's able to mention cognitive assessment, mental confusion, and all. Because of our time, we will not stay too long on each question again, so that we're able to cover at least. We're able to cover so many questions.
Yeah, but I think
And what's the next one now?
this question was one of the questions we asked last week, if I'm correct.
Yes, yes, was part of us last week. I'm not sure. She was here. I
I
mean, we
think so.
asked it last week. So let's go to the
Yeah.
next question just now. You see it on your screen in a minute.
All right. So a post-operative patient is at risk for respiratory complications. What nursing interventions are crucial to assess and address respiratory compromise? Your time starts now. Time starts now. Thank you. So a postoperative patient is at risk for respiratory complications. What nursing interventions are crucial to assess and address respiratory compromise? All right, you have less than 30 seconds left. Not slow level. Cardiac position. This- All right, thank you. Can we have our answer, please?
Okay, now that's all. That's all. No more answers because we won't even take them. So the closest is what?
Let's have our answer first, please. We apologize for the network glitch
Oh, our
today.
answer
We're so
first.
sorry
Sorry,
about
sorry
that.
for that.
Yes, thank you.
Yeah,
So,
yeah.
um, our answer is monitor respiratory rate, administer incentive spirometry, and encourage early ambulation. Sorry, I'm having tongue twist. And provide effective pain management. All right.
Hungry, hunger.
Oh my god. So let's take a look at our answers and
You take a cup of tea.
right. So let's take a look at our answers. We've got um, a lot of answers. Uh, the first answer was vital signs for baseline data. That's the nurse influenza.
That's baseline, yes. It's like you saying one out of three,
Yeah, I
but
think she still
we have
said a
somebody
couple
who
of
said,
she still said a couple of things. She said bed rest. But again, we want your answers to be together. The nurse
oh, she
influencer.
mentioned somebody.
Nurse influencer, you're doing quite a good job, but we want you to put your answers together. So
Oh,
take
okay,
out
that's
the
true. That's
time.
true.
It's not
So,
just about
vital signs, bed rest.
yeah. It's not just about giving an answer. Just take your time, put your answers together, and then you can give your answer. So it helps us to be able to organize the answers that we have from different individuals.
Thank you, Gospel. So, P said, check and monitor
Is
SPO2,
that
I
supposed to be
guess.
flow
This
level?
SPO2, vital signs, and issue unfortunately check. Maybe she meant to say
Flow.
SPO2. Is that what?
Oh yeah, yeah.
I don't
I
know.
don't
Just
know.
Ladoko is saying cardiac position, international oxygen, respiratory rates, elevating the head of the bed, it encountered, and it's not going to help us because the thing is, if you put if you scatter your answers, it's not sending the right message because if you put your own answer and you put another point, it's just assumed that you probably saw it from somewhere. You got a clue from what the other
Yeah,
person put there. So it's not just to
that's true.
to give you the answer for dropping your whole comment. Put it together and post it once, and would give you the answer. Will give you your prize. Okay. Yeah. Peace later said this SPO2 she meant. That's fine. Assess respiratory
Okay.
rate and also give oxygen therapy if possible. Mubarak is saying that. So, Gospel, who is close? Who is close to the answer, or who has more of the? God, I'm not
I
even
think
spotting anybody close to all we.
if you highlight I know Rebecca and you know, could you please highlight her? Let's see what she says again. Because I think she said no, she said early ablution and something. Abby. Oh, that's wrong, Seth. Early ablution. Not correct.
No, she said something. I'm going to pop it up now. Oh my God, that's not here. Coming. Just a minute. Okay, so this is what she said. Early ambulation monitor respiratory rate. I think she's right with these two, and she's right with that too. Peace. They said SPO2. Well, SPO2 would have been correct, but the most important thing is the respiratory rate.
Yeah, monitor their respiratory rate.
Respiratory rate. But we'll go on to saturation. You get what I'm saying? So, uh, gospel, I'm leaving
Yeah,
it to you. Or you are the quiz master. This
am I?
simple question. Sorry.
So let's see. Let's start again with what the first answer we got, because I'm struggling to get.
So what we are trying to look for is respiratory rate, ambulation, pain management. So the person is a post-operative patient. Because she's a post-operative patient, pain is a major reason why they have all of these
Yeah,
respiratory abnormalities. So what nursing intervention are crucial to address respiratory compromise?
I
Is
think we
monitor
should.
well done. Then, oh my God, we monitor the respiratory rate early ambulation manner. So we've got four men.
Let's give let's give the um answer to Rebecca, and then we'll give to the nurse influencer as well.
Okay, that's great. That's great. That's great. That's great. The nurse influencer said a few correct things. This lady that said
Yeah.
monitor SpO2 level, vital signs, check for this. Uh, Oxygen administration. Oh my god, I'm struggling with this network so bad. Sorry about that.
Yeah. You're all
Gospel.
right. You're
So
all right.
your final verdict, the nurse
Let's
influencer,
give it to nurse
she's
influencer,
got
and
2 out of 4.
she's got 2 out of 4. Let's give to Rebecca. She's got 2 out of 4 as well.
Yeah, and Rebecca I know got how many out of 4 as well.
She got 2 out of 4 as well.
Okay. So so that's basically getting half of
Yeah. So let's just give them. Let's just give
that's
it
basically
to.
getting half of 1,000 naira.
Yep.
So the nurse influencer and Rebecca, noted. Let's go to
Yeah.
few more questions. Few more questions and we are done.
That's us.
Okay. My God. Let me look for more simpler, straightforward question. Now,
It's
this is
been
the
it's
question.
been hypertension night tonight. So a patient with a history of
Yes, it's intentional actually.
heart failure exhibits signs of fluid overload. The nurse implements dash to manage his condition. So a patient with history of heart failure exhibits signs of fluid overload. What are the signs of fluid overload? So you have your edema and the rest of them. So the nurse implements dash to manage this condition. So please, let's try and put
This one
all
is
our
straightforward.
answers together. Put all your answers together,
Put your
even if you
answers
want to give us
together.
20 answers. Yeah, let's try and have them together. The nurse, what would you do when you have a patient who exhibits signs of fluid overload? Somebody should just say furosemide. I said it. Give furosemide. Every and now fruit. Oh my god. Catheterization.
I'm happy we have a lot of people responding. So it's not just one
Yep.
person winning all the. Anyway, somebody has won a lot of it today. Anyway, so
Right. I know, right?
it's still somebody winning
So
most of it.
that's us. What's the answer? What's the answer? What's the answer? Can you please have the answer?
You get the answer. Just three answer.
Diuretic therapy, fluid
Yeah, it's coming.
restriction,
It's
and
coming.
daily weight monitoring. Okay. So we have peace. Peace says give furosemide. Let's just take that as a diuretic. She says monitor
So let's
input
see what.
and output, and then she says catheterization. Then we have Esther
Well,
Daily.
that's capitalization.
Yeah, categorization is not, it's not really a necessity, because what if this patient is mobile and is able to go to the toilet, even though catheterization in itself would
Yeah,
help you to
yeah. It
do
need to be managed outpatient. You don't need to
yeah,
categorize them.
yeah. So but again, catheterization as it is would help you to do a proper fluid balance, that's monitoring the fluid intake and output. But again, what if the patient is outpatient and sometimes do patients refuse catheterization? So somebody else says give diuretic,
The
Esther
most
Davis.
important thing that a nurse can do.
I think most of the answers we are having here, no one, well, nobody really said anything about daily weight monitoring, and that is quite essential. Hmm. Someone says placing the patient in an upright position to relieve pressure on the lungs. Right. That's. But once you just place the patient on the diuretic, it's going to help to remove the fluids that we have in the patient's body, and that would as well help to relieve pressure on the lungs. Damilare, are you with us? Damilare.
Anyways, see, I'm actually with you, Gospel, and I'm trying to think through all the answers I'm getting here.
I think we should just give it
Just trying
to
to
peace
see.
this time around. Let's just give it to peace, even though categorization is there as well.
Yeah,
But
Peace got two correct answers.
yeah,
But it's
so
important to note this is just for learning purpose that you're trying to address the problem of fluid overload. Think
yeah,
outside, think outside inpatient care always,
yeah,
and that's part of why I added some questions that relates to public health and stuff. Think outside inpatient care. When the patient is still able to mobilize around, your goal is to try to restrict fluid and advise the patient, oh, don't take too much. Don't take more than 1 liter of fluid per day, all of that. Because
yeah,
this person saying monitor input and output now she's actually thinking she's in the hospital where she will have a chat and she's writing, Mama,
yeah,
you drank 100 mils of
yeah.
water, we put it down, that kind of thing. So, um, so think outside the confines of hospital.
So just for jokes, you know
Okay,
how it is.
gospel. So we are giving peace because she gave the first correct answer. Diuretic therapy one, fluid restriction. Nobody talked about weight monitoring at all. I did not say anybody talked about
Yeah,
weight monitoring.
nobody did at all.
Nobody talked about it. Nobody. So that's just two correct answers out of three, and we're going to just give it to her. 2 out of 3
Yeah.
times 1,000 naira. That's 2 by 3 of 1,000 naira. I hope that's noted, Kenny. 1,000
Oh
naira
my God.
goes to
How much?
Peace
How much is that?
Oluwaga.
How much is that? 1.33
Do
naira.
your maths.
I was saying just for jokes. I was saying
Do
that
your do your math. Do your math.
I was saying just for jokes. I was saying um you know how it is that by the time you get to the end of your shift and you have patients who were on 1.5 liters fluid restriction, and they have your fluid balance chart, and then you just notice that you've not done any you've not done any fluid balance all through the day. And so you just come at that point and start writing 300, you write 300 mils, 400 mils,
I mean,
500 mils.
the one that cracks me up the most is when you try to ask the patient, please, I will let's leave that for another day.
Oh my
Oh my
god.
God. Let me
But you know,
ask
in
this
some places
question.
they
We are
actually
going to
have
be
a
closing
description
by
of
7:30.
what
So, oh sorry, 7:30. Okay, that's 8.
is your time 7:30 in K2.
Gospel, are we good?
We are good though.
Sorry. I moved to the island just now.
Oh my god. All right, well, let's go. Let's move on to the next question so we could save time and do our closing
Okay,
formalities
let's
as well.
go with this question.
All right, a patient with a history of substance abuse is admitted for detoxification. Oh my God. What nursing assessments and interventions are essential to address withdrawal symptoms and prevent complications? So your time starts now. The question again says a patient with a history of substance abuse is admitted for detoxification. What nursing assessments and intervention are essential to address withdrawal symptoms and prevent complications? GMOS.
You must. Oh my God. What's that word? That Glasgow.
Yeah,
What's that thing? Glasgow Aqua withdrawal.
yeah.
This nurse
Somebody
influencer is just a typical Nigerian nurse. Everything
check right outside that.
vital signs for baseline data. It's very interesting.
Oh my god. Your patient go tire for you. Go say, go say you're always checking my vital signs.
Oh my God.
All right, so what's the answer? What answer do we have for
Oh
that
my
question?
God.
We just have two persons
Okay,
who
the
have
time
asked.
don't finish.
Yeah, time to finish up. So it says monitor vital signs.
So this
Finally,
time
vital
around, she's
signs
correct.
at this
Monitor
time.
vital sign.
Administer medications for withdrawal symptoms and provide emotional support while ensuring safety. Uh, I,
Yeah.
I think we should
So
just give
who's
it.
got something close to it?
Let's just give it to nurse influencer. Let's just give it to
The
nurse
nurse
influencer
influence has
because
got it, Abby.
she says check vital signs for baseline data, and then she says check create a nurse to patient relationship. So let's say provide emotional
Mm,
support covers that nurse patient relationship.
mm,
And then though
mm,
nobody said anything about Oluwabamire said for intervention, give meds. What kind of meds are we giving? I know said placebo and health education, substitution of addicted drug with a non-addictive substance. Uh,
mm. That one almost won my heart.
why will you win your heart? Hmm.
Yeah, now
Nobody
because
ac-
it's close to the answer now. She's
nobody
saying
actually
something
said
like
something about
she's like placebo, but placebo is not even advised. I don't know. I have a mental health nurse in my room.
patients are even able to identify some of a patient who is experiencing withdrawal symptoms. Sometimes they are so used to all these things, and there was a day that a colleague of mine was giving I think diazepam to a patient, and when the patient saw the diazepam, patient said that was 5 milligram of diazepam, and that was not 10 milligrams of
Mm-hmm.
diazepam. So
Mm-hmm.
the lady was
Mm-hmm.
like, "No, that's 10 milligram of diazepam." The patient said, "No, that's not 10 milligram. That's 5 milligram of diazepam." So in that context, the lady went back to check the box of the diazepam that she just gave the patient, and she found out that in the box
Mm.
it was labeled 10 milligram of diazepam, but inside the drug container it was 5 milligrams. So somebody actually made the mistake of putting a 5 milligram sachet of diazepam into a 10 milligram sachet. So most times they actually know these drugs that you want to give to them. So I don't know if placebo is going to help the patient in terms of stopping withdrawal,
I'm
because
even thank you for that, and I'm even considering the legal stuff, the legal side of it. Is it right?
yeah.
Is it legally right to give a patient placebo? Like, especially when they have the capacity to decide what you do for them
Yeah.
based on their health. If, in fact, somebody who is coming for withdrawal,
Oh my
somebody,
god.
that's in your own set. Oh my God, my network is
This
crazy
your
here.
K2
Okay, back.
network. Ah.
Okay, I'm back now. So I'm saying that when when they ask
Sorry,
network
we
is
sincerely apologize.
when they ask for help with them or whatever you're working is, I don't advise placebo. It's there's a legal side to that. I think you can
Yeah.
check it up. Anybody listening and watching, it's a legal side to placebo that you don't just give it placebo. That's like telling them a lie.
Yeah. No, but another, if you even
Okay,
look at it from if you look at
but
it from the perspective of,
who's got something close to it?
I say
Okay, go on, sir.
let's give it to the nurse influencer. Let's give it to the nurse influencer. But I was trying to say that if you look at it from this angle of when you're administering a medication to a patient, if you're in a society that is woke, like they really know the medications they are getting, they would not just take anything from you. So a lot of patients nowadays are aware of what they take. They know. They don't just know the names of these medications. Sometimes they know, like I was saying before, the color of the medication that they take and how many milligram they get, all that. So once you bring a placebo to them, they would ask you, "What is this? What are you going to say to the patient?"
Mm-hmm.
And of course, the patient has every right to say, "I
Mm-hmm.
don't want to get that." So
It's something that I'm not sure because I when we are doing some of our trainings here, we're like we will give the patient placebo. They said no. They said no, you don't give. Rather just be honest and play with them that this is it. And if they keep coming, we keep telling them
yeah,
we offer you these other options until you're able to contain the person. And if medicate forms of addressing the issue, you know what I'm saying? So that's just something, by the way. I think that's a takeaway thought for everyone who is watching tonight. But back
yeah.
to the question. Um,
So
we've got the nurse
let's give
influencer
it
talk about vital signs for it.
let's give it
She
to the
got one who
she got
gospel.
two. She
When
got
somebody
two.
said health education,
She got two. She didn't just get one.
I'm not against somebody's. I'm not against somebody who be depressed today. Okay. She got two. Okay, then that's fine. 2 out of 3, and
Yeah.
2/3 of 500. Sorry, of 1,000 naira. Whatever that is, you get. So I'll get to the last question, guys. I'll go to the last question. So those of you that have gotten one prize or another, Please don't forget to wait till the end of the where you will see the account number, sorry, the phone number you are going to chat up, and then you can redeem your prize. Okay. Gospel, are we good to go for the next and final
Yes, we're
answer?
good. We're good.
Final
Soldier
question.
on.
Sure. Okay,
Soldier
this
on.
is quite interesting. Let's
All
go.
right. A patient with. Oh no, I can't find the question again.
Sorry, it's coming back
A
again.
patient
It's
with
coming back
tracheostomy
again.
is at risk for infection. What comprehensive nursing assessments and interventions should be implemented to prevent complications? Your time starts now. You have a patient who is on a tracheostomy and normally they are at risk for infection. So, what comprehensive nursing assessments and interventions should be implemented to prevent complications? All right, we still have like 30, 30 seconds left. And this is the final question, just to say thank you very much to everyone who's taking out the time to join us, and those of us that have been here from the beginning of this edition of the Nurses Quiz Night. So thank you very, very much. We really appreciate you, and we also apologize for the glitch in network today. Mm, all right, we've got two answers. Okay, that's us. All right. So we've got three answers. Can we have the answer, please? So the answer is maintain a sterile tracheostomy tube, perform regular dressing changes, and provide patient and caregiver education on tracheostomy care. We can't hear
Why
you.
am I muted? Just
Eh?
sorry, I said it was tracheostomy site, not tube.
Oh,
Seems you're hungry. You need to come to K to come and eat.
no. I don't deal with K2 brethren.
I think Peace is the first to drop her answer. I saw the her answer first,
Yeah, she was the
and she
first.
said daily tracheostomy care, antibiotics, bath birth.
What's bad bet?
Just bed bath, I suppose.
I can't understand.
Is it part of the answer?
No. The antibiotics is, if you're giving antibiotics, you are already
Is sterile
probably
tracheostomy site?
if you give antibiotics, there's already an infection for you to be giving antibiotics. Do we give antibiotics because we are trying to prevent infection?
Yeah.
Hmm? Am I right or wrong? I don't know.
And the idea is, what is a nurse? What are we going to be doing as a nurse?
Yeah,
Abi, is that all what the question says?
I think so.
Nursing, kilape.
Yeah,
Yeah, inter nursing. This is the question again. Let's see the
assessment and
question.
intervention.
The patient with tracheostomy is a ratio. What comprises assessment and intervention should be there? So nursing assessment is nursing.
Yeah.
So we should focus on nursing. The answer is so the care of the tracheostomy site would have helped for this maintenance of sterile. What she said is correct about that. Then
Hmm.
regular dressing changes would also help promote sterility, caregiver education and everything on tracheostomy care. That would also matter. So let's
Yeah.
see. Yeah. So I'm going to spotlight again the answers. So let's suction in daily care of tracheostomy, give antibiotics, bed bath. Um, we are not really interested in antibiotics just now. We're trying
Yeah.
to prevent. Try to prevent. To be honest, try to prevent. Okay. What's the next one?
Says to
Prevent
prevent infection in patients
include
with a crisis for me,
aside check, proper
nothing is
hygiene,
necessary
cleaning. Yeah, this looks like something.
close to the answer. So we've got care of tracheostomy sites and
Yeah,
administer prescribe antibiotics. Everybody's already rushing into antibiotics.
antibiotics. Everybody's thinking medication first. Wow, that's interesting. Prophylactic antibiotics, aseptic technique when cleaning. Yeah, asepsis is, I mean, aseptic technique of cleaning is very important.
Yeah.
Dressing is sterile. Yes, sterile
Ensure
dressing.
the
Yes,
is
that's
the
something
ensure the
more
doors are
nursing
closed
related.
during dressing for me. It's to ensure that the doors are closed during dressing for me.
Yeah, now typical
Oh my
for our
god.
motherland.
Put off your fans. Put off your
Them
fans
can
and
put off.
close the window. Oh my god. All this so
When you want to do
sorry, we're just winding
check
up with
vital signs.
your answer. No
It's just,
influencer. Don't take it personal. It's just that it's bringing memories.
I beg you,
It's
don't take
just
it personal. Oh. You're doing all right.
it's just bringing some memories back.
He's bringing all memories exactly of
Oh
nursing
my
school.
god. I'm telling you. So who are
Check
we
vital
giving
signs.
check vital signs, ensure
Ensure
right
right
position of
position
the
of
tube?
tube.
Waiting they
Prophylaxis
go
report display
waiting
of
they
tube
go find
immediately.
for the
Rebecca,
tube.
Ah,
May you
these
go
people, they are giving enough stuff, plenty stuff. There is no nursing.
waiting they go find for tube. May you go do
Maintain proper
comot the
tracheostomy
tube.
tube care. Yes, this person is close
Yeah, and
and
ensure
ensure
proper
proper.
hand hygiene.
No. You know the tube. Dress it properly. That's what that concerns you as a nurse. Dress it and make sure that there
Yeah,
is sterility. And tell the patient, oh,
yeah,
this is how you do. Don't make sure you don't do this. That's what that concerns you as a nurse. See whether antibiotics will be given or not is the doctor's is at the doctor's discretion. Sometimes
yeah,
sometimes they would have the stop or decide the stop. So the decision on antibiotics or medication generally is up to the doctors. Where
yeah,
we come in is administration and then monitoring. But
yeah,
more importantly, as nursing care is the care of the tube, and that's what I am more important. I'm keenly looking forward to seeing in the answers. So,
yeah. If you
oh,
look
you're
at
a
the
fresh
question,
graduate. That's why.
the
Happy to see you. Happy to have you
the,
here.
que-
Thank you very much.
the
So,
question
Ross,
is nothing.
who is getting this?
So I think if we look at uh I don't know now. It's quite confusing. But I think there was someone that just to me for what the question is and trying to um, promote the fact that it's actually nursing care we're looking at. I think we should give it to Omirinde Kurimat. Is that and sorry I must have pronounced the
Yeah, the
name
very last
wrong.
person, Abi. Yes,
Yeah,
he talked about proper tracheostomy tube care. Yes, ensure
yeah,
proper hand hygiene. I think she's
yeah,
got 2 out of 3 correctly.
yeah.
Um,
I think we should give it to
position
her.
of the tube. I understand everybody is concerned about prophylactic, but what if the doctor did not even give prophylactic antibiotics? That's not up to us. So,
Yes,
like we
yeah.
said, we're going to give it Omiride Mukrimat. Omiride Mukrimat.
Kurimat.
Because this is our very first one, so we're getting. I don't know. I'm sorry if I murdered that name. I'm sorry. But
We apologize.
gospel.
Yes.
Is that horse?
Yeah, that's all for tonight.
Okay.
That's all for
Yeah, thank
tonight.
you guys. Thank you guys. I think we've got a number of people who got. How many people did we have? Sorry, let me see. Well, I think from the list here, we've got Ojediran, I know, Nurse Influencer, Adebisi Esther, Idris Popola, Peace, and Omirinde. All of these people I've mentioned got one prize or another. So when you chat us up, please give me your number again. I don't forget your number. Oh my god. I'm going to put
Number way, cramp for head that
the
year.
number you have you. No, I don't forget now.
All right, so thank you very much. While that is going on, while he's trying to put up the number, just to say thank you very, very much for taking our time to join us. And we apologize once more for the glitch in network that we experienced. It's so unfortunate that our brother is in K2 and this network was just bad all night. So, well, next month we're going to try to get him out of K2 and bring him to the island so that at least
Okay, oh. To the
we will not
island.
experience we will not experience this kind of network issue again. But all the same, we really appreciate everybody that took our time to join us tonight. And big shout out to our studio man and woman and our back
Please share
end.
it. Please like it. Please, everybody share. Everybody.
I'm doing shout outs now.
Yes, our back end support. Please
Yes,
keeping on the
so
record. Thank you. Thank you.
thank you, back end support with them. Then thank you, everybody. The list is long. We cannot begin to call the names and appreciate every one of you for joining us and staying with us till the end. And I really
To
appreciate
the
you.
end, we had
Thank
a very good turnout today. Much better than last month. Yeah,
Yeah.
thank you, Gospel. Thank you. Sorry, the network is making all our talk enter each other. Very, very sorry. But yeah, just saying that we had a very good turnout this month, which is much better than what we had last month. Thanks to all those who shared. Thanks to all those who invited their friends who will be looking again. All right. So as we close, you just enjoy enjoy yourself and continue to be the best that you are at your different various field of practice of nursing, whether in Nigeria or outside. All right, and sure that we continue to give our best to our patients, um, because that's really what we're here for. We're here to do the fucking job. Just do the job. Just do the job right, and then continue to improve yourself. All right, and make sure that knowledge is what makes us stand out. It's not about the noise. It's never about the number. It's about what we have upstairs. You know what I'm saying? So keep giving the best, keep giving your best wherever you are. And God bless every one of us. Gospel, is that all saying sign out?
Yeah, that's us today. And so we'll see you next time, next month on this platform. Don't forget to like, share, talk about this. You know, if you won any prize today, for those that won today and those that won last month, just do some shakara for your friends and tell them that there's something happening here. I would like to see you and your friends next month. Thank you very much. That's us. Peace out. Why did not remove me?
Oh my God, I'm not ready.